Welcome to the Deep Dive. Today we're tackling a topic sent in by one of you. It's a really challenging and often heartbreaking condition that affects our feline friends.
That's right. We've got a stack of materials here. Vet articles, research summaries, treatment guides, all looking at something called feline caudal stomatitis.
Okay, let's dive in. Our mission today, using only the info you've shared, is to sort of cut through the jargon. We want to understand, what this painful thing is, why it's such a big problem for cats, and what the latest thinking is on treatment. Consider this your focused guide to getting a real handle on it.
Exactly. We'll walk you through the key stuff, pointing out what's most important and, well, why it matters.
So first things first, what exactly are we talking about? The sources call it feline caudal stomatitis, FCS, or sometimes feline chronic gingival-stomatitis, FCGS.
Yeah, basically, it's a severe chronic, meaning long-lasting and intensely painful inflammation inside a cat's mouth. It's way beyond just, simple gum disease.
And that word caudal seems important. The sources really point that out.
Oh, absolutely, that's key. Caudal means it's not just the gums right by the teeth, like gingivitis. This inflammation is heavily focused on the back of the mouth.
The very back.
Yes, specifically the caudal oral mucosa,
Yeah.
those tissue arches near the throat, the palatoglossal folds, and the pharyngeal arches. That specific location, highly suggestive of this condition. It can affect the cheeks or tongue too, but that back area is really the hallmark.
Got it. So much more widespread and severe than, say, just a bit of gum irritation.
Definitely, much deeper and more painful.
Okay, so if a cat's going through this, what would you actually see? The materials really emphasize a pain aspect.
Pain is the absolute defining feature, and it's profound. You might see a cat who seems hungry, goes to the bowl, but then just backs away.
Well, that's rough.
Yeah, or they might cry out when they try to eat, or even just when they yawn. Sometimes they paw at their face, or, vocalize if you try to touch near their mouth.
Just heartbreaking. What are the knock-on effects of that kind of pain?
Well, obviously, not eating much, or refusing food altogether, anorexia or hyperexia. That leads to weight loss. You often see excessive drooling, too.
Drooling?
Yeah, and the sources describe it as often thick, kind of stringy, sometimes even bloody drool. And bad breath, halitosis, is really common because of all that chronic inflammation.
And this, I hadn't considered the sources mention poor grooming.
Right. If their mouth hurts that much, grooming becomes painful. So their coat can get scruffy, matted, just unkempt, and the pain itself can cause behavioral changes, lethargy, maybe hiding more, appearing depressed.
And if a vet actually looks inside the mouth, what do the lesions look like?
They describe seeing this intense, fiery red inflammation. Often the tissue looks puffy, maybe proliferative, like it's growing excessively. Sometimes there's ulceration, open sores.
Especially in those back areas.
Especially in those caudal areas we mentioned, yes.
Yeah.
And it's different from typical gingivitis, where the inflammation might just be on the cheek side of the gum. With stomatitis, it commonly surrounds the entire tooth.
Okay, so it's incredibly painful, affects their whole demeanor. But why? Why does this happen? The sources seem pretty clear the exact cause isn't one single thing.
I think that's right. The primary cause isn't known, but it's understood to be what's called a multifactorial immune-mediated disease.
Immune-mediated. What does that mean here, practically?
It means the cat's own immune system is, overreacting massively. The current thinking is that it's an inappropriate or exaggerated immune response to various things, antigens present in the mouth.
Like what sort of triggers?
The main culprit seems to be bacterial plaque on the teeth. The sources note that even really tiny amounts of plaque can set off this extreme immune reaction in susceptible cats.
Just regular plaque.
Seems so. And then viruses are strongly implicated too. Feline Calicivirus, FCV, is found really often in these cats and is considered a major trigger, maybe even something that keeps the inflammation going. Feline herpes virus might also play a role in some cases.
Are there other contributing factors or associations mentioned?
Yeah, a few. Tooth resorption, TR, comes up. It's probably not a direct cause of the stomatitis itself, but the inflammation from those painful dissolving teeth can certainly add to the overall fire, so to speak.
Okay.
FIV and FeLV are also discussed. Cats with these retroviruses might be more prone or have a more severe case, and this is important, the sources specify these viruses are not direct causes. And interestingly, most cats with stomatitis actually test negative for FIV and FeLV.
Yeah, that's interesting. Anything else?
Bartonella is mentioned, although its exact role seems a bit debated, and there's a suspicion of a genetic predisposition. Certain purebreds like Abyssinians, Persians, Siamese, and a few others are listed as possibly being more prone to developing it.
So if you see these signs in your cat, how does a vet actually diagnose FCS?
Well, it relies heavily on those clinical signs we talked about, combined with a really thorough oral examination.
And the sources stress this exam needs to be done a certain way
Yes, absolutely crucial. The oral exam must be done under general anesthesia.
because of the pain.
Exactly. It's the only way to safely and completely assess the entire mouth, especially those really painful caudal areas, and to properly document everything that's going on back there. You just can't do it properly on an awake, painful cat.
Makes sense. What other diagnostic tools are used?
Dental x-rays. They are absolutely essential. They show what's happening below the gum line, hidden problems like tooth resorption, any retained root fragments may be left from previous issues, or severe bone loss from periodontal disease. You miss a lot without x-rays.
Okay, x-rays are key. What else?
A biopsy of the affected tissue. This is needed for a definitive diagnosis, to confirm it is stomatitis, and just as importantly, to rule out other serious things that can look similar.
Like cancer.
Exactly, particularly oral squamous cell carcinoma, or maybe eosinophilic granuloma complex, or even deep fungal infections. The biopsy, the histopathology, usually shows a characteristic pattern of severe inflammation dominated by lymphocytes and plasma cells.
Are there other tests they might run?
They'll usually recommend testing for infectious diseases like FIV and FeLV just to know the cat's status. FCV testing, like PCR, can be done, but again, the sources note finding the virus doesn't prove it's the sole cause, though a high viral load could be significant. And routine blood work is important too,
Why blood work?
to check the cat's overall health, rule out other systemic problems that could cause oral signs like, say, kidney disease causing uremic stomatitis, and to get baseline values, maybe check things like globulin levels, which can be high with chronic inflammation.
This really sounds like a challenging condition to treat effectively. What do the sources say is the best way forward?
It absolutely is challenging. It can be frustrating, and treatment is often prolonged. It's usually multimodal, meaning several approaches are used, but the sources are incredibly clear on one point. Aggressive surgical dental intervention is the cornerstone, the absolute main thing.
And that means extractions, right?
Potentially.
It's a lot of extractions.
Yeah, precisely. The whole principle is remove the teeth, remove the surface where the plaque lives. Since plaque is a major trigger for the immune overreaction, removing the teeth dramatically reduces that antigenic stimulus that's driving the inflammation.
Okay. And the sources mention different degrees of extraction.
They do. One source talks about maybe starting by extracting just the teeth behind the canines, the premolars and molars, citing a study with decent success rates for that initial step. Around 60% resolution, 20% needing meds, 20% not resolving.
Right.
The other source, and frankly the overall emphasis in the materials you sent, strongly leans towards full mouth extraction, or FME. That means taking out all the premolars and molars, and often the canines and incisors too if they're involved or the inflammation is severe there. This is highlighted as the most successful approach for the majority of cats.
Full mouth extraction. Wow, that sounds, well, it sounds really drastic.
It can seem that way, absolutely. But the sources are quite reassuring that cats adapt remarkably well to being toothless. They can still eat perfectly well, often even dry food once healed. Yes. The critical thing is the surgical technique itself. It needs to be meticulous, creating proper gum flaps, carefully removing all root fragments, smoothing the bone edges with a drill, and crucially, using dental x-rays before and after the surgery to confirm everything is out.
And what are the outcomes like after FME generally?
Generally, much, much better than with other approaches alone. The prognosis after properly performed FME is significantly improved. You're looking at roughly 60 to 80% of cats seeing significant improvement or even complete resolution of their clinical signs.
That's a pretty good number for such a tough condition.
It really is. Many can go back to a normal life, eating well, free from that chronic pain.
So what about medications then? Are they used at all, or is it just about the surgery?
Oh, medications definitely have a place. But usually as an adjunctive therapy, meaning alongside or after surgery, or for those cats that unfortunately don't fully respond to the extractions. The sources are very clear that meds shouldn't be seen as the primary long-term solution on their own. Their long-term success alone is often limited.
Okay, so what kinds of medications are we talking about?
Well, pain management is crucial for quality of life, both leading up to surgery, immediately after, and sometimes ongoing if needed. This involves things like opioids, buprenorphine is often used, sometimes given orally, and NSAIDs, non-steroidal anti-inflammatories, though they need careful use and monitoring in cats. Sometimes other pain meds like gabapentin are added.
And drugs to tackle the immune system.
Yes, immunosuppressants are used. Corticosteroids like prednisone are often used initially for severe flare-ups because they work quickly to reduce inflammation. But the sources strongly discourage relying on steroids as the sole long-term therapy.
Why is that?
Because of significant side effects with long-term use, things like diabetes, weight gain, muscle wasting, and often their effectiveness tends to decrease over time. They're more of a temporary measure or for specific
So
situations.
what are the alternatives to steroids?
Cyclosporine is highlighted as an often effective alternative. It works differently, targeting specific immune cells, the lymphocytes. It can be used longer term, but it also has its own potential side effects to watch for, like GI upset or gum overgrowth, and it takes longer to start working than steroids.
Any others mentioned?
For more severe or refractory cases, the ones that don't respond well, other immunosuppressants like chlorambucil or mycophenolate mofetil might be considered.
And antibiotics, do they help?
Only the sources specify if there's a clear secondary bacterial infection of the lesions themselves. They are not a primary treatment for the underlying stomatitis, which is an immune issue, not primarily a bacterial one.
Got it. Any other therapies mentioned?
Let's see. Feline recombinant interferon omega is mentioned, particularly maybe for FCV positive cats. Bovine lactoferrin, omega-3 fatty acids for potential anti-inflammatory effects, certain oral rinses, and one source mentions CO2 laser therapy as well.
And what if a cat is just in too much pain to eat while they're figuring all this out or waiting for surgery?
That's a really important point. Nutritional support, often using a feeding tube like an esophagostomy tube, might be necessary temporarily. It ensures they get calories and allows pain medication to work so they can become comfortable enough to eventually eat on their own.
So putting it all together, all these different approaches, what's the overall outlook? What's the prognosis for a cat with FCS?
It's definitely variable, but often it's considered fair to good, especially if they undergo aggressive treatment like full mouth extractions.
And what does that range of outcomes look like practically?
Well, like we said, that 60–80% group sees significant improvement or complete resolution. They get their quality of life back. Then maybe another 10–20% improve noticeably, but might still need some intermittent medical management, like occasional anti-inflammatory medication, to keep things under control.
And the rest?
Unfortunately, there's a small percentage, maybe around 5–10%, who remain symptomatic and painful despite doing everything right, including FME. These are the truly refractory cases. Their prognosis is more guarded to poor, and managing them might involve lifelong, multi-drug immunosuppression, or sadly, if the pain just cannot be controlled, humane euthanasia has to be considered for quality of life reasons.
Can it? Can it come back after treatment?
Relapses are possible, yeah.
Oh.
Particularly if the extractions weren't totally complete, maybe a root fragment got left behind, or in those cats needing ongoing medical management if the immune suppression isn't quite right or needs adjusting.
It really sounds like managing this takes a huge commitment from the owner.
Oh, absolutely. The sources really hammer home the need for client education. Owners need to understand this is a chronic, painful condition, and there's usually no quick fix.
They need to be prepared for the long haul.
Exactly. Prepared for the major surgery of extractions being the key, ready for the postoperative care, diligent with pain management and giving medications, and keeping a close eye on their cat. Patience is crucial. 2, full improvement can take weeks, sometimes even months after the extractions.
And the goal is always?
The goal is always pain control and improving the cat's quality of life. That's paramount. The sources also mention that for really complex or refractory cases, getting a referral to a specialist, like a veterinary dentist or an internal medicine specialist, can be really helpful.
Wow. That was, a really deep dive into a very tough topic.
Yeah.
It's so clear now that feline caudal stomatitis is just worlds away from simple gum disease, much more complex, much more painful.
Absolutely. Understanding that immune-mediated component and why the extractions are so critical removing that trigger, it really reframes how you think about managing it, doesn't it? It highlights this really complex balance the body's trying to maintain and how sometimes you need a big intervention to quiet things down.
It really is fascinating, though, how removing teeth, which just sounds so extreme on the surface, can be the most direct route to resolving such awful chronic pain for a cat. Makes you think about how adaptable they are.
It does, and how sometimes the most direct solution, addressing that underlying trigger, is the way to go, even if it feels counterintuitive at first.
Yeah.
It also really underscores how important it is to pick up on those subtle signs of pain in cats. They can be so stoic, it makes it hard for us to realize just how much discomfort they might be in.
So what does all this mean for you, listening?
Well, hopefully, For you, it means having a much clearer picture of feline caudal stomatitis. You understand the level of pain involved, the potential immune triggers, why the diagnosis needs those specific steps like anesthesia and x-rays.
And why extraction is so often the most effective path to relief.
Exactly. Even though it's not a guaranteed fix for every single cat, it offers the best chance for the majority. You understand that medications help manage things, but surgery often addresses the root cause more directly.
Okay, here's something to maybe think about after this deep dive. Consider how much chronic illness, not just in cats, maybe in other areas too, could be rooted in these kinds of complex, sometimes aberrant immune responses to seemingly small everyday triggers like plaque or common viruses. How does that change our perspective on treatment? Maybe moving beyond just symptom management.